Good morning, everyone. My name is Leslie Dock, and I'm the chair of Protect Our Care. Thank you for joining us today. We're here to talk about the importance of lowering the cost of insulin for the over 20 million diabetics in the United States. Thanks to President Biden, the members of Congress you see on your screen and their Democratic colleagues, the Inflation Reduction Act helped more than 3.2 million insulin users on Medicare, so that they will no longer have to pay more than $35 a month for their insulin. And across America, seniors have already seen the benefit of this life-saving change over the last month and a half. Unfortunately, because of the refusal of Republicans in Congress, however, 21 million insulin users under the age of 65 were denied these same benefits, and they continue to pay far too much for their insulin and suffer the health and economic consequences. Nearly 1 in 5 adults skip or ration their insulin costs to save money. And this is disproportionately true among Black Americans, where 23% are forced to make that horrible choice compared to 16% of their white and Hispanic counterparts. And 14% of insulin users report spending at least 40% of their income on insulin. The cost of the sacrifices they have to make to skip doses can often lead to death. Not surprisingly, capping the cost of insulin is overwhelmingly popular in America, supported by 88% of Americans across the political spectrum, except, unfortunately, Republicans on Capitol Hill. President Biden has repeatedly called on Republicans in Congress to drop their opposition to this life-saving benefit and to join Democrats in passing legislation that would cap the cost of insulin at $35 a month, regardless of age, but they continue to refuse. Instead, they continue their war on America's healthcare, seemingly doing everything they can to raise prices and reduce access to care. They've promised to repeal the Inflation Reduction Act, which would, of course, raise prescription drug prices, insulin costs, and insurance premiums for tens of millions of Americans. And they have particularly singled out Medicaid and the Affordable Care Act, many calling for trillions of dollars in cuts to Medicaid, cuts to Medicare, and cuts to the ACA. To discuss the importance of these issues, we're joined today by House Assistant Democratic Leader James Clyburn and Representative Lucy McBath from the 7th District of Georgia. Senator Clyburn has represented the state of South Carolina and has been a champion on healthcare and equity across America as he fights for progress. Representative McBath has also been a tireless fighter for lowering insulin prices, and she was the one of the lead authors of the Affordable Insulin Now bill, which she first introduced in Congress in 2022. And as I mentioned, Assistant Leader Clyburn has been a champion of healthcare throughout his entire congressional service. We're also joined by Elise Oberdorfer Douglas from Atlanta, Georgia, a mom. Her 17-year-old daughter has lived with type 1 diabetes for the last 9 years, and she and her husband have struggled, like so many Americans, with the cost of healthcare and the emotional and health impacts of working hard every day to be sure their daughter gets the insulin she needs to stay alive. And while they continue to worry about the costs of insulin, they now have to worry also about these attacks on Medicaid and on the ACA that have helped them obtain healthcare over the last several years. And with that, I'd like to turn it over to Congressman Clyburn. Thank you. You're on mute, Congressman.
Thank you. Thank you so much. Thank you so much for allowing me to be here with you. And thank you, Lucy, for your tremendous work in this area. I often, as I just did about an hour ago, I had a joint press conference here in South Carolina with South Carolina's governor. and we were talking about telehealth. And I use a story of my wife's 30-year battle with diabetes, and of her father, who, when he passed away, was a double amputee because of the late detection of diabetes. And so I have lived with this disease for a long, long time, and I have been diagnosed myself as what the doctors call pre-diabetic. So I don't know what pre-diabetes means, but it seems to me that we have to do what's necessary to reduce the cost that so many people are experiencing with this disease. I happen to have looked at my wife's bill, monthly healthcare bill. She, aside from needing 4 shots a day of insulin, she had other things that diabetes cause: a heart attack, a stroke, kidney failure, all of these things because of diabetes. Now, the insulin at sometimes would be $800 a month, sometimes $1,200. Insulin, we were able to afford it because we had good health insurance. But the fact of the matter is, too many people cannot afford their insulin. And if there's anything you cannot take shortcuts on, it's the medicine that people need in order to maintain a good quality of life. The research is done. We know that at $35 a month, pharmaceuticals can make a profit. Insulin has been around for over 100 years. The research indicates that we can make it and package it at $10 a month. And so the $35 a month is a pretty good profit. So why would one be paying $800 and $900 a month? That should not be. And we should not have healthcare being meted out according to people's wealth status. You got good insurance. You don't live in a state like South Carolina where they have not expand Medicaid. South Carolina is one of the 11 states that did not expand Medicaid. So there are a lot of low-income families that cannot afford the current cost of insulin. And so this $35 per month cap was a godsend. And it's great that the Senate agreed with the House as it relates to the people on Medicare. But what about children who are born every day with juvenile diabetes? I've had them here in my office in this conference room. And I know what families are going through with little children and not being able to afford the insulin. So I do believe that this is something worth doing, and it's something that should be done. And let me close my comments with this. I know what they say about Medicare, Medicaid, and not wanting to increase the cost. The fact of the matter, it's very clear that reducing the budget, our expenditures, seem to be once again put on the backs of low income and moderate income citizens. That is what you're doing. And to say that we won't take this into account when we're doing a 1.6 $7 trillion tax cut to wealthy people. I don't understand that. That's not what this country is all about. This country is all about what we learned in Matthew 25:45, doing for the least of these. And when we do harm to the least of these while giving benefits to those with the most, we're not carrying out our responsibility to each other. And so I want to thank you all for your work on this and let you know that you can continue to count on me to be supportive because I know the experience I had with my wife, to whom I was married for 58 years, her father. These experiences should not be put on the backs of people who cannot afford the cost. And I'll yield back.
Thank you, Congressman. There's just sitting here absorbing all of that once again, and thank you for your leadership and your commitment to this. Representative McBath, we look forward to hearing from you.
Well, thank you so much. I want to say thank you first and foremost to Assistant Leader Clyburn for telling your story and for your words and just really for your leadership. I too come from a state where one of the 11 states here in Georgia, we did not expand Medicaid. So of course we see those kinds of tragedies and tragic circumstances for those that are suffering by diabetes all the time. But that is the reason why I'm really so pleased to be with Protect Our Care today and all of you to talk about the work that we continue to do to ensure that there's affordable access to life-saving prescription drugs. And I want to thank Protect Our Care for your tireless commitment to protecting and strengthening access to healthcare for millions of Americans and all those guests that have joined us today. We're so grateful to have you with us as well. You know, the healthcare of our children and our families is never far out of my mind. It's amazing how quickly the world seems to just stop when a child or a family member gets sick. And there are many across the country who know what it feels like to get difficult news from your doctor. And I'm one of them. And your heart sinks, and it can be the only thing that you think about is your health at that moment. Twice I was told that I had breast cancer, and twice I was blessed to have the health coverage and phenomenal doctors to care for me. And twice I was able to overcome my battles with breast cancer. So I'm very proud to call myself a two-time survivor. But I know how blessed and how lucky I was to have those fantastic doctors and quality health care. And there are far too many Americans. You know, the cost of healthcare can be the difference between putting a kid through college and affording treatment. And that just simply should not happen. It's why I'm so proud to have led a bill that capped the cost of insulin at $35 a month for our seniors in particular. That bill became law, and the cap took effect at the start of this year. We are continuing this fight to make this life-saving drug more available, more affordable, because there's no time off when you live with diabetes. It's a constant, ever-present disease that influences every aspect of your life, just as Assistant Leader so eloquently gave us his experience with his wife. And those born with diabetes live their entire lives checking their blood sugar every other hour, and they must constantly be wary of what they eat, what they drink, and you know what they must do to monitor their lives to survive. And parents of diabetics often spend their days just so concerned about their children's health, worried that their kindergartner who's gone off to school and must for the first time ever and ensure that they have to check themselves all on their own. And we know that almost 40 million Americans live with diabetes, and over 1 million of them live right here in Georgia alone. Many of those who live with this chronic disease must take insulin every single day of their lives to survive. And even still, it remains the seventh leading cause of death in the United States. In 1920, before insulin was even discovered, it would have been exceptional for diabetic patients to live longer than a year or two. But for over 100 years, the discovery of insulin has saved lives and has remained the most effective treatment for all those that are living with this chronic disease. So why then, after 100 years, is this life-saving medication farther and farther out of reach for those families who need it the most? That is why expanding these savings for them are so critical. This is about saving lives. And by capping out of pocket costs for insulin to $35 a month for everyone, we can keep this life-saving drug, a drug that has existed for over 100 years, affordable for the families who need it the most. We heard President Biden celebrate the progress that we made during the State of the Union, and we heard him make it clear that we must do what is needed to lower the cost of drugs for American families. He was very candid about that. So I'm very proud to have led the fight in the House to cap the cost of insulin for millions of Americans. And of course, my fellow Georgian representative, he's not representative, but Senator Raphael Warnock, he and I led the fight, and he led the fight in the Senate to make this law. So we're here today to continue this fight for those who sent us to Washington on their behalf. And we'll continue to do this work to expand savings for these life-saving drugs because the American people deserve it.
Thank you, Congresswoman. I mean, if there's no more common sense thing than that the Congress could do than to move forward on this. And I hope your colleagues across the aisle will recognize how important it is to so many, regardless of political party. Let me turn this over to Elise. She was sharing her story with us earlier. It echoes the things that both of our other speakers have said about its impact on an entire family. So, yes. Elise, thank you for being here and for talking about your own family and your daughter's battle.
Thank you very much. Thank you very much, Leslie, for having me, and Representative McBath and Representative Clyburn. It's really hard to think when I decided to come to the United States 26 years ago, I came with this dream, like everyone else, the American dream, where you come and you work hard and you're able to live a decent life. And then you have kids. And one of your kids is diagnosed with this horrible, I call horrible disease because it changes you. It changes your child. I always tell her, it's not just her having diabetes, it's all of us, because it's basically when you have to take care of, when an 8-year-old have to manage her life, like taking insulin 4 or 5 times a day. You have to worry so much. Like you go to the hospital, you stay in the hospital for 3 days. You leave the hospital, you go with no insulin, of course. You go to the pharmacy to get your first prescription. You don't expect that 2 little vials of insulin, this big, is gonna cost you $750. And that's for 15 days. So per month, only in insulin, when she was diagnosed for the first year, we were paying $1,500 a month in insulin, only insulin. This is not counting the test strips to check blood sugars and all the other stuff that comes with the diabetes. It's hard. It's really, really hard. and thank God, when you are running out, I'm sorry, I gotta go back here for a second. I have many times I almost ran out of insulin, and you open your refrigerator and you have one vial left, and it's like, how can I afford another vial? What about if the vial breaks? What about if it's misplaced? What about if it's left out? If you lose power, okay? If you lose power, your house gets hot, the insulin is bad. So if you don't have money, can you buy more insulin at that point? So a lot of us, we turn out to our groups online, Facebook groups, type 1 diabetes, where we ask, I need an insulin. Can anyone help me? I had twice people from Canada send me insulin, twice someone from Colorado to send me insulin, and other states, but those are the ones that were more impactful. Like one of the ladies sent me like 8 vials of insulin. And for me to know that I wouldn't have to worry about insulin for 4 months, it was like, oh my God, it's such a relief. This should not happen in here. It should not happen on the most powerful nation in the world, where like we should not be put on this situation where we have to ask people for medicine to keep our children alive. You know what I mean? Like, you shouldn't have to ask, to beg on the internet for someone to help you. So your daughter or your son, or they wouldn't die. In Brazil, and my niece was diagnosed last year. She was in a hospital for a week. She was not kicked out after 3 days, basically, like, you stay there 3 days in the United States, and then they said, okay, now you go home, no matter if you're prepared to take care of your child or not. They send you home with no insulin. In Brazil, they send you home with everything. The government pays for everything. And Brazil is a third world. Again, we are the most powerful nation in the world. It shouldn't be like, healthcare should not be a card game. It should not be something that, okay, I will do this if you do me that. This is rights. It's rights. Anyone that have lived with anyone or know anyone with type 1 diabetes, or type 2 for that matter, should know. Our Republican representatives should think hard about, it shouldn't be that hard to know that people need treatment. If they don't take insulin 3 or 4 times a day, they will die. They will end up in a hospital. And then they might not have money to pay for hospital. So what would cost you more to help people with insulin? Lower the price to $35. We need this. Dr. Bentley did not make insulin to be sold for $350, or someone I saw a receipt another day, they paid $880 for 2 vials of insulin. He did not invented insulin to be used as a profit like this. Like the congressman said, $10 costs to make a vial. And if we have over 4 million diabetics in this country, how much money can we be making, out of the $25? It's just greed. All of this for me is just, it's greed. I don't see how can you be against making people's lives a little easier just by providing insulin with an affordable price. It's in my opinion, it's sickening. It's horrible because they don't get cured. Type 1 diabetes has no cure. It has nothing to do with what they eat. No matter what they eat, they will have to take insulin. And what happens a lot, adults, is that they stop eating carbohydrates, which is bread, pasta, rice, because they cannot afford insulin. A lot of them are college students, which is heartbreaking. So they can minimize the amount of insulin that they are taking. They stop eating carbs. And then they ended up in a hospital with diabetes, ketoacidosis. It's a very hard word for me to say. And they ended up in a hospital and they died many, many times. They passed away because they couldn't afford the insulin. So they cut up on their food, on their amount of carbs and sweets intake. And a lot of them passed away. So I'm begging. I'm sorry.
Take your time.
Our Republican representatives to please help us. It's not that hard. I'm sorry. I really would like that money would not be an issue for families that wouldn't have to choose between paying their rent and keeping their kids alive, or
Thank you.
paying for college and keeping kids alive. It's hard. It's hard. Thank you.
Thank you. So hard. Worrying about your daughter, keeping her healthy and well,
Yes, and I
keeping
have
your
met,
family healthy and well. So it's so hard. And as you say, it shouldn't be. Thank you.
no, it shouldn't. It shouldn't be.
I'm just trying to see.
It shouldn't be. And not to say that we didn't have a good insurance when she was diagnosed. We had a good insurance, but our copay was $8,000. So yes, it was, even though after you reach a copay, the vial of insulin was still $75. Even after you reach the copay, that they keep saying, oh, you're almost reaching the copay, or you're almost reaching the copay. And it never happens. You know what I mean? Like, I thought, well, 8,000, I was horrified. But it was like, oh no, but every time, even after we reach our copay, every time we went to the pharmacy to get her prescriptions, it was never below $750 because it has to come with test strips, monitors, and then insulin pump. And it was never like, they can never say, oh, now it's going to be free. No, it's never free.
Right.
Insulin never, the price never.
Never. Thank you again. We should
Thank you.
probably see if any of our other speakers and reporters on the phone. I think all of us are quiet now after listening to your bravery and the struggles. Wish you the best. I don't know if either of our other speakers would like to say something now, and then we'll also just see if there are any questions from the reporters on the line. Maddie, do you want to see if we have questions?
Sure, yeah. So if you are a reporter on the line, you can ask a question by clicking the raised hand button at the bottom of the screen. And as always, you can email us a question or chat us a question in the Zoom chat. I can give it a minute to see who has questions. All right, it looks like we have Victoria Knight from Axios. Victoria, you should be able to talk now.
Hi, can you hear me?
Yes.
Okay, hi, thanks so much for doing this. Yeah, so I was talking to some Senate Republicans last week, particularly Senator Josh Hawley has actually proposed doing a $25 insulin cap for everyone. And I talked to some other Senate Republicans that said they were interested in looking at that, but a lot of House Republicans seem to remain opposed to such a cap. So do you guys have a plan to talk to House Republicans about this? Kind of like what is your path moving forward to try to get Republicans with you guys on doing a cap for everyone?
Dr. Clyburn or McBath, do you want to?
Well, thank you very much for that question. Yes, we've been talking to Republicans forever about this. And of course, we passed a bill in the House and we had several Republicans who support it. And we don't need but 10 of them in the Senate. And we could pass it. As you know, in order for the bill to get favorable consideration on the floor, they have to have 60 votes to cut off the debate. And I suspect all 51 of the Democrats will be voting to cut off debate on this subject, which means you need 9 Republicans to join them. So if Mr. Hawley has got a $25 cap, I'll vote for it, as we say down in Gullah Geechee country, in a skinny minute.
And I'd like to piggyback on that, as Assistant Leader says, we're always willing to do any price negotiation with our Republican colleagues. We really hope that is something that they are considering, but in the interim, our families needed some immediate help right now. And, this law now really lowers the cost for drugs that Americans need immediately. And it's just like I've said, it's designed to provide immediate support and help for those who can't afford to pay for this life-saving drug that keeps them alive. And we'll continue to, there are always ways, of course, that we're looking to tweak and make Americans' lives better. So we do welcome the ability to be able to talk to Representative Hawley if he has something to offer that really will help even more the American families that are suffering from this really harmful disease.
Thank you.
It's hard to imagine that people who've listened, or if they would listen to stories like Elisa's, could continue to be opposed to this. But that's the Congress we live with. Maddie, any other questions?
Yeah, so we have one more question from Joseph Choi at the Hill. Joseph, you should be able to talk now.
Hi, Congress members. Thank you for doing this call today and speaking on this topic. That was the question I was also going to ask, similar, but kind of taking it broadly. Republicans recently have indicated that they're somewhat backing off on Medicare and Social Security issues. Senator Rick Scott last week dropped those from his proposed 5-year sunset rule. What do you make of Republican lawmakers seemingly backing off on Medicare and other federal healthcare problems? I know that they have proposed cutting down on ACA subsidies. Some conservative analysts I've spoken to say that they don't feel that that's a serious issue that they're going after. But broadly speaking, what do you make of the seemingly backing off of that?
Well, I think they're listening to people. They're listening to the public. And I think that the public has made it very clear that this is something that's very, very important to them. And I'm very pleased to see that they're backing off that notion. I've been around for a while in the Congress and on Earth, really. And I remember the Republican efforts during George W. Bush's presidency to privatize Social Security. And it's kind of interesting that it was less than 2 years after they proposed to privatize, we saw what happened to the stock market. Under Bush administration, do you remember what happened in September 2008? What would have happened if all that Social Security had been on the stock market at the time? So Social Security is what it is and should remain what it is. It's been around since 1935, and it is a very good program for senior citizens. Medicare, very good program for senior citizens. Medicaid, very good program for low-income citizens. And we ought to keep these programs healthy for people so that they can stay healthy. And so I'm glad to see that they're backing off of those notions. And I hope that they will stay true to their calling.
And as Assistant Leader Clyburn said, I'm glad as well to see them backing off, because I really think it undermines everything that we've done to make sure that people have access to these life-saving drugs. And I just think that first and foremost, we can't play games with people's lives. And that's what we're talking about here. And we have an opportunity right now to save, hundreds of thousands of lives and lower the costs, for tens of millions of families. And so I'm glad to see that they are backing off of, any other forward ideas that they might have. The American public, as Assistant Leader has said, they have spoken. Of course, we're always looking forward to work with our Republican colleagues for price negotiation but we do have to be transparent. And we just have to make sure that we're always working together and collaborating on the best ways to take care of our constituents, because there are constituents in our Republican colleagues' constituency in their districts. They have constituents that suffer by diabetes, just as Democrats do. So this is not a political decision. This is not Democrat. This is not Republican. This is a matter of saving as many lives as we possibly can.
Thank you.
Joseph, I'd say that I wish I was as optimistic as the two members who spoke today about the intentions of their Republican colleagues. So certainly on Medicaid, they have not backed off of their efforts to take trillions out of Medicaid or to repeal the Inflation Reduction Act, which would eliminate this hard-fought drug benefits. So I think the American people should be very nervous until the ink is dry. And we've moved forward with this year's debt ceiling legislation and a budget, and we've kept these programs intact. It's far from guaranteed. Maddie, any other questions?
Yes, we have a question from Veronica Waters at WSB Atlanta. Veronica, you should be able to speak now.
All right. Thank you so much. I appreciate everyone for this call. Thank you for having us. I've got a couple of questions too about maybe the planning for the cap. To be clear, is the cap you're proposing and pushing for all insulin users, whether they've got private insurance or not? My other question would be, what kind of support are you seeing from the companies which are largely sort of dominating the insulin market? Are they on board with this?
Can I speak to that specifically in terms of even, being a Georgian?
Yes.
This bill does focus on the insured. And it has become increasingly clear that Republicans in Georgia in specific want to make it harder and more expensive for Georgians to afford the quality care. It's never been our intention just for this to be for those that are insured. We want every American in this country that suffers from diabetes to have access to a cost and reduction for this life-saving drug. Governor Kemp's refusal to expand Medicaid and provide hundreds of thousands of Georgians with access to health coverage, it just really continues to make it more difficult for people in our state, for our hardworking Georgians to get the care that they need. And so, this is something that the federal government would pay almost all of. But the Republicans in Georgia would rather play politics than make healthcare cheaper to get, better to have, and easier to use. And so I really kind of remain outraged, as many of my Democratic colleagues do, at this kind of toxic political stance. We're proud to say that we have co-led the Medicaid Save Lives Act, and that's a bill that would just give anyone in non-expansion states like Georgia access to Medicaid, should it be eligible, and just giving more Georgians more options to do what's best for their families and their loved ones. And so, I'm just speaking from a Georgia-focused narrative, but this is the narrative of all the other 10 states as well that didn't receive expansion in Medicaid. But this is something that we fight for in Washington every single day, to make sure that everyone has access. That's their right to be healthy.
Mm-hmm. Congresswoman McBath, there is this pushback about competition too, when you have like what we see here in Georgia and some of the other states maybe are the ones who are saying, well, what about the competition in the market? What if this hurts the businesses? I guess is their argument.
Well, yes, we've heard that. We've heard that before. But of course, I guess the focus for us is just making sure that we're doing everything that we can competitively. We hope that, everyone would see the writing on the wall and begin to make, not only just this drug, but any other kind of drug or equipment or anything that's associated with it, that they would also begin to understand that, there's money to be made. There's money still to be made, even at the reducing of the price of the cost of insulin. Competitively, these businesses are still going to make money. Millions of individuals are suffering from diabetes. And so that is something that they really need to consider, is that, diabetes is not going away at this point. We've not been able to find a cure for it. So they need not be anxious or worried that they're not going to make money in this industry.
And has there not been some support for this from some of these big companies? It was my understanding that some of these companies were on board with this idea. Maybe Eli Lilly might have been leading the way on that. I'm not sure, but at some point, I think some months ago, I had read that these companies were in favor of this idea, or several of them were.
I have not. I'm sorry.
No, go ahead. Go ahead. Sorry.
No, you should go first, Congresswoman.
No, I've got plenty to say, but we want to hear what you have to say too.
I don't recall any active support from any pharmaceutical company for this. They've spent their time on Capitol Hill trying to champion the status quo, spending hundreds of millions of dollars a year on lobbying. As both representatives said, insulin costs $10 to make and bottle up, and people at $35, there would be plenty of room for profit, and also plenty of room to invest in innovation. I mean, basically, we're looking at the same drug over the last century, but also Americans pay 3 to 4 times more for the same drug than any people do in any other country in the world. And so this is not a question of fair competition. It's a question of milking the market for every penny these companies can get, and it's at the expense of everyday citizens grappling with these issues.
Yeah, and I just like to say, this bill is a really strong first step in reducing the price, of insulin. And, there's always more that can be done. And we have to continue to revisit over and over again our ability to be able to reduce the cost of all kinds of drugs that people need to live on. But right now, this is just the best first step that we can make. And we'll continue to do our work and just making sure that people are healthy and have access to these life-saving drugs they need.
Thank you all so much.
Thank you. Well, I want to thank Congresswoman McBath and Congressman Assistant Leader Clyburn, and of course for Elise, who had the courage to share her story like this. And Elise, I know your daughter's soon going to be going away to college, and I wish you well and nights where you can sleep well as she goes off into the next chapter. So thank you, everybody, for your time today.
Thank you.
Thank you so much. Keep up the good work. And Miss Elise, take care.
Thank you too. Thank you very much.